Okay, friends. Hello, everyone. Uh, Today we will discuss about a most important case, that is iron deficiency anemia, right? And it is the best case. I will tell you so much about that. Okay, yeah. Um, as you can see here, the case is like this: a 17 years old female. How many years? 70 years. 70 years meaning uh, there is iron deficiency anemia's common cause in this year of the girl is menstrual cycle, right? Yeah, menstrual cycle because of the blood loss because of the blood loss by menstrual cycle is the most common cause. Okay, is the most common cause uh, in the female of this year, of this age, right? uh, the आयरन डेफिशिएंसी एनीमिया, फॉर द आयरन डेफिशिएंसी एनीमिया इसमें क्या हुआ है कि इट कंप्लेंस ऑफ fatigue, after that weakness and difficulty in the concentrating for the past 3 months. Why? Because there is a hemoglobin, less of hemoglobin. There is less hemoglobin production. Okay, and so that less O2 reach to the brain, and so that this problem is occurring. Yeah, and it has also frequent headache, right? Yeah. On further questioning, she mentioned that her menstrual cycles are regular but heavy and last for 6 to 7 days. Means this is the main cause. Look here, the cause is given here, that why the iron deficiency anemia occurs. Okay, yeah, 6 to 7 days and a heavy menstrual cycle, right? Yeah, and it mainly consists of rice and vegetables, but it rarely consumes green leafy vegetable. So green leafy vegetable it consumes rarely. So this is the second cause of the iron deficiency anemia. This is the first cause of the iron deficiency anemia, and after that, or iron rich food, right? Yeah. She appears pale. Yeah. Her nails are thin and slightly spoon-shaped. This is sign and symptom. This is a sign and symptom of the iron deficiency anemia. Thin and slightly spoon-shaped nail, which is called as the koilonychia. Which is called as the koilonychia. Okay. Now, pulse rate. Pulse rate is 96 per minute, and the blood pressure is 100, 100 out of 100. 100 is systolic blood pressure and 60 is diastolic blood pressure per mmHg, right? Yeah, and laboratory investigations shows that MCV 70 FL, hemoglobin is 8.5 gram per dl, MCH and serum ferritin level is low. Okay, so this is the main. This is the main, and specifically the low serum ferritin level is the main to check the iron deficiency anemia. Yeah. Okay. So MCV's range is about 80 to 100 femtoliter, femtoliter, right? MCH has around uh, what says that 20 to 33 picogram. Yeah, and serum ferritin level range serum ferritin level range is around about 15 less than 15 ng per ml, right? Yeah, and hemoglobin, yes, hemoglobin's range is 12 to 15.5 gram per dl. This is the normal ranges. Now you can see MCP level is decreased, and here it is tell that MCH and serum ferritin decreased. Okay, and hemoglobin is also decreased. Now let's understand some important point about the iron deficiency anemia. Okay, yeah. So in that first point, that serum ferritin level decrease in the normal or mild iron deficiency anemia. If there is chronic iron deficiency anemia, it is because of this chronic iron deficiency anemia is because of the kidney or liver damage, right? Yeah, and in that there is a hepcidin level increase the hepcidin level. As the hepcidin level increase, there is uh, hepcidin does, hepcidin destroy the transporting, like here is the cell, and Fe2 plus in the cell comes out from the cell by the transporting. As these level decrease, hepcidin level increase, the transportin will more and more destroy, so the transportin level decrease, and so that Fe2 plus remains inside the cell, and it converts into the ferritin, and so that the serum ferritin level increase. Okay, clear. This is the first point. What is the second point? Here, uh, as the Fe level decrease, iron deficiency anemia, so that iron level decrease, and so that there is what is the RD of the iron? Nearly about 29 for normal woman, and 27 for pregnant woman, right? And 90, around 90 for man. Yeah, and as the iron level decrease, so then hemoglobin production decrease, and as hemoglobin production decreases, the size of the RBC is decreased, and another point that hemoglobin level decrease, so MCH decrease, and as the size of the RBC decrease, there is decrease of the MCV. Okay, these 2 points. Yeah. Now, if we give the iron supplementation, iron supplementation, then there is iron level increase. As the iron level increase, but the lifespan of the RBC is around 120 days longer. Okay, sorry. Lifespan of the RBC is around 120 days longer, right? Yeah, and so that what will happen? That the iron, if the iron level increase, but the size of the RBC not suddenly increase, suddenly not increase. It takes time to increase the size of the RBC because it requires the new production of the RBC, right? And in here, as the size of the RBC decrease and the hemoglobin also decrease, it is called as micro. It is called as microcytic hypochromic. Okay, so this is the second point. Now the third point, the ion absorption. Yeah, third point is about ion absorption. Vitamin C like vitamin C increase the ion absorption, but like uh, uh, like just a minute. Hydrate, oxalate, etc. decrease the ion absorption. Okay, so that is the green leafy vegetable, just a minute. Green leafy vegetable has iron, but as the green leafy vegetable has high iron amount, but there is a problem that they contains high amount of the oxalate ion. So that if we increase so that ion absorption will decrease, although iron is in high amount in them. Okay, but so that uh, doctors suggest meat for the iron rich food instead of the green leafy vegetable. Because in the meat there is a iron source is less than the green leafy vegetable, but they cannot contain the oxalate ion, so that the iron absorption is normal rate. But in the green leafy vegetable, as they contain high amount of the iron, but there is a oxalate ion also, uh, high amount of the iron, but also present of oxalate, and this oxalate will decrease the iron absorption. Whereas in the meat there is low iron with respect to green leafy vegetable, but they uh, but in that the iron absorption is high. Okay, so doctors suggest meat instead of the green leafy vegetable. Now these oxalate ion are high in the beetroot, amaranth, etc. And so that uh, in the iron deficiency anemia patient, the doctors suggest to avoid the beetroot, amaranth, and the tea and coffee are the main for decrease the iron absorption. Okay, so doctor suggests to not to take them and tea and coffee, right? Yeah. Now there is one last point is remaining. After that, all the iron deficiency anemia will be become easy. Last point is about the TIBC. Why the TIBC is increasing the iron deficiency anemia? As the TIBC increase, there is the increased amount of the transferrin. Now, what is the transferrin do? अ, अब ट्रांसफेरेटिन क्या काम करेंगे, तो ट्रांसफेरेटिन जो हमारे में एक तो पहले से ही आयरन लो है, ठीक है। तो अगर ट्रांसफेरेटिन मॉलिक्यूल कम होंगे तो आयन जितना है उतने में से भी कम ट्रांसपोर्ट होगा। इसलिए हम टी आई बी से इसलिए हमारी बॉडी में टी आई बी से इंक्रीज़ होता है, जिससे ट्रांसफेरेटिन इंक्रीज़ होता है। सो दैट अगर एक भी आयन मॉलिक्यूल बचता है हमारी बॉडी में, वो भी ट्रांसपोर्ट हो सकता है, ठीक है, बिकॉज ऑफ द इंक्रीज ट्रांसफेरेटिन, ठीक है। सो बॉडी ऐसा ध्यान में रखते हैं कि हमारे बॉडी में कोई भी आयन मॉलिक्यूल ट्रांसपोर्ट करना बाकी ना रह जाए, ठीक है। या so that is the importance of the transferrin. Okay, so here the iron deficiency anemia is finished, and this is the case which I have answered above, right? Yeah, and you can see that. Okay, friends, we will meet in the next lecture. Thank you. Thank you. Next video. Yeah.